Hey, welcome back to Fertility Fact or Fiction, and we have an amazing show tonight. We are going to be talking to you folks about the endometrial receptivity array, a total hot button topic for loads and loads of people who want to know about it. It's obviously a big thing in the infertility world, and I think we've got a really interesting program for you tonight to go over that. Of course, we'll be answering all your questions as we always do. And super excited to be back with you guys again, as always. Thank you so much for all of your follows. We are literally a couple people away from having 5,000 followers. So a lot of hard work and a lot of messages and a lot of Instagram posts, and we're almost there. So thank you for following. Thank you for attending these video sessions every week. Thank you for giving us the opportunity to help you on your journey. I do, while we're kind of spooling up, want to throw a totally anonymous shout out to absolutely one of the most amazing people I have ever had the opportunity to work with. So brief story, we had a patient who had trouble in a previous pregnancy and could not carry on her own, again, because of the risks that she posed to her pregnancy. And so she actually had her mom get involved, and we did IVF for her, took the embryos, put them into her mom, and her mom carried that baby all the way up to term and just delivered the other day, despite some significant medical complications that her mom had to go through. So I have nothing but awe and respect for that incredible, incredible woman. So if you're watching, or if your family is watching, congratulations from us at VRC, from everyone watching with us, of course, and God bless you. Thank you so much for what you did. The joy and the warmth and the love that you have brought to your own children is absolutely beyond words amazing. So big round of applause, loads of love and likes from everybody here for you. Thank you so much for what you did. I can't think of a more sacrificial thing a parent could do. So I am totally in awe of you. And I really have always thought my mom was the best, but you're definitely up there. So thank you for what you did. Thanks for bringing it to a very successful and happy conclusion, and much love to the family. Hopefully you guys are enjoying your baby and not watching our show right now, and speedy recovery. And if you need me, you have me on speed dial, so I am happy to accommodate anything you need. So let me know if there's ever anything we can do. I think we're almost there. Exciting news. Doug Ford is coming to Windsor, and so with some luck, maybe we'll get a chance to tug on his ear a little bit and ask if he can help us with funding. So we'll see if that works out. And hopefully the Premier will enjoy the tour of Windsor and bring us some good news. So we're working on that fast and furious, and the college is finally inspecting again, so we should be able to do our egg retrieval once they grant us, an inspection, which should be within the next couple of months. We're hoping. We have impressed upon them the importance of the inspection process for Windsor, because we don't really want patients going back and forth from Windsor to Toronto, to minimize the risk of transmission and spread of the virus, obviously. So we're working fast and furious for all you guys to get everything up and running. In the meantime, cycles are moving along at Create, and they are an amazing team of people there. So I really have fallen in love with all my teammates down there. We're starting to do some surgeries down there so that you guys won't have to wait a crazy year for surgery, which is absurd, and I apologize on behalf of all physicians, but we have nothing to do with surgery times. So we're getting to do some surgeries down there, and I'm actually hoping that if my embryologist says yes, we might actually set up doing some of the surgeries here in Windsor for you as well. And a huge shout out to our team in Sarnia, who's been doing an amazing job. Much love to you ladies, and James, who have put together a great program for us down there. And there will be some more highlights coming because we're expanding soon into some new locations. So I won't share any details quite yet, but when we're there, we'll let you know, and we'll bring you on board for that as well. Okay, so I think we've got our 8:05 time. I usually like to start after 5 minutes where everybody's had a chance to jump on board. And we'll go through it all and explain everything. So, starting at the beginning, we picked a really hot topic, and I want to give you a little bit of history here. So I was at a conference in Chicago several years ago when a very prominent fertility specialist from Spain came up and started talking about this amazing program called the ERA, and that stood for Endometrial Receptivity Array. So the endometrial receptivity array is a test where they test the lining of your uterus for several hundred genes and the levels of the activation of those genes to determine if your endometrium is receptive or not. So that's why they gave it the name of endometrial receptivity array. And it uses some pretty sophisticated technology. The testing's all done in Spain. It's run by this company called iGenomics, and the company was really set up to take over this specific product, this specific topic. So, for some reason, my Instagram phone is going dark every few seconds. So if you see me poking, that's why. So, bottom line is, they did an amazing job with this, and they got it, marketed. And they said, look, we've had people with thin linings, we've had people with linings that didn't look good. And so we couldn't get them pregnant. So then we did these endometrial receptivity arrays and we popped embryos in and they're all getting pregnant. And so they kind of turned the world upside down for IVF because everybody thought, wow, this is like the holy grail. Let's figure it out. So I'm not going to lie. I fell for it hook, line, and sinker and thought this sounds amazing. Let's do it. So we started doing it initially only for the people that failed. And then we thought, well, why are we only doing it for people that failed? Maybe we should be doing it for everybody. So then we started kind of promoting doing it for more and more people. As time went on, we realized it doesn't look like it's making as much of a difference as it should. And we would get people that were non-receptive, so you have to adjust the time. They'll tell you you're either pre-receptive or post-receptive or receptive. So if you're receptive, you're using the normal timing of progesterone. If you're pre-receptive, it means you need more progesterone. And if you're post-receptive, which we never saw, that means you're going too far. Your progesterone's too high or you're too loaded. You need to back up a day and put the embryo in it earlier, which is a little unusual. And even they themselves say very few patients are post-receptive. So we did it, and after a while we realized this doesn't look like it's making a huge difference. So we kind of started to switch and started monitoring progesterone levels really carefully, and then we continued doing some ERA just to kind of see what would happen. And when we continued with the ERA tests, we found out that less than about 5% of the patients were asynchronous. So the whole idea behind this test is you've got this day 5 or day 6 embryo, and you've got to have 5 days of progesterone, and they have to be lined up. They got to be synchronous. So you're putting your day 5 embryo into your day 5 lining, and everything should work out perfect. Turns out that when we monitored the progesterone levels, less than 5% of our patients ended up having that asynchrony. And it's not a cheap test. They charge about $750, if I remember correctly. And we had to charge for the blood tests and the monitoring and the paperwork and checking all of your levels and telling you how much to take and what to do and so on. So, it was adding up to like $1,250 Canadian for the test. So we started shying away from it and moved away. And then I think it was about last year, it was one of the first topics we did with Fertility Factor Fiction, where I showed you guys that not a single study out there actually supported the use of the ERA. Every single study that had been done up until that point had demonstrated absolutely no benefit to doing the test. There were some that were saying maybe it works, but none of them had actually showed a statistically significant improvement. So finally, after ages and ages, comes this study, which is titled A 5-Year Multi-Center Randomized Controlled Trial Comparing Personalized Frozen and Fresh Blastocyst Transfer in IVF. So this is the ERA test applied in order to create what they call a personalized embryo transfer. So they're marketing it towards people by saying, this is for your body, it's for your uterus, it's for your endometrium. This only applies to you and it's only kind of good for you. So it's randomized, which is the kind of trial we want. And so they basically took the patients and they assigned them to one of three groups. One group got the personalized embryo transfer, one group with frozen embryos, one group got a frozen embryo transfer without it, and the other group was just the fresh embryo transfers. And then they compared the results between the three groups. So this was multi-center, done out of Spain because iGenomics is from Spain. And they took participants who were undergoing IVF at their first appointment. They were 37 years of age or younger. Their body mass index was reasonable, 18.5 to 30, and they all had normal ovarian reserve. So keep in mind, this study only actually applies to the patients that meet those criteria. You can't take this and then say, oh, well, I'm 42 and I'm either too thin or too heavy, and I want this data to apply to me. It doesn't, because they didn't include those patients in it. They also didn't have men who had very severe male factors. So that's another element of it that's important for you to remember. Okay, so what did they do with all this? Well, they took this, and we may run out of batteries, guys, on our live studio here. So if you're watching on Facebook, you may lose us. Switch to the Instagram account. It's rahivictory.md. Because we may lose our battery supply here. Okay, so where did this leave us? Well, let me pull up the file and hopefully I can show you guys this. And I want to be able to share the data. Here we go. Okay, so we're going to blow that up. Okay, so if you're watching on Facebook, YouTube, you should be able to see this. I'm going to flip to table 1 really quickly. It's actually not table 1, it's the flow chart. So essentially the very first thing they did was show who's who in the data. So there was no difference in any of the factors in terms of diagnosis, the number of people who had PCOS or endometriosis, male factor, and so on. They checked all of the groups, previous tries, previous miscarriages. It was all the same. There was no difference between any of those elements. So then they have this lovely flow chart, and this is where this study starts to fall apart. So the wheels do come off, and I want to warn you all in advance, okay? So they started off with 569 people in this study, but only 458 were actually randomized. Why? 111 needed to be excluded. 50 because they didn't meet the criteria, 43 because they declined to be involved, 8 for some reason were double randomized. I don't even know how you do that. And 9 had some kind of inclusion error. They don't specify what that was. So they ended up with 148 in the personalized embryo transfer, 154 in the frozen, and 156 in the fresh embryo transfers. So it's quite a complicated graph, but they lost a ton of the patients because many of them, almost half in each group, bailed and left the protocol for a variety of different reasons. Whether it was an earlier embryo transfer or a later embryo transfer, or their progesterone was off, or whatever had happened, and they had to alter things. So they switched out of the protocol they were supposed to go into a different protocol. So what they ended up with from 148 people with the PET, they ended up with 81 that ended up going to the personalized embryo transfer, and then one more dropped out because they terminated the pregnancy, so you actually ended up with 80. From 154 in the FET group, they ended up with just 92 that actually followed that protocol. And from 156 in the fresh, they ended up with 94 that actually followed through with the protocol. So you're starting with this big number of over 500, and then you're ending up with 80, 92, and 94 that actually followed through on the treatment. So huge loss of patients. So right from the get-go, you got to know when you're going into this, you may not actually follow your protocol and spend all that money and then not do what the ARROW test told you to do. And that's actually what this test is actually going to end up saying to you at the end of it all. Okay, so what happened when they actually studied it? Well, here are the cycle characteristics. And in the cycle characteristics, what they ended up showing, which is important, is that there was a difference, a statistical difference, between the number of patients with day 5 and day 6 embryos. So you can see in the frozen embryo transfer group, there were 11.5% with day 6 embryos, only 4.1% with day 6 embryos that got transferred in the fresh embryo transfer group. Probably makes sense. Normally we don't wait till day 6 to do fresh embryo transfers. And then as well, the day 5 embryos were 69.5% in the personalized embryo transfer group, but then 75.7 and 82.1 in the other two groups, the frozen and the fresh respectively. So there were differences in the number of embryos that were day 5 and day 6. And if you guys remember or were watching a couple weeks ago when we did the presentation for Fertility Fact or Fiction talking about the day 5 embryos versus the day 6 embryos, the day 6 embryos are actually supposed to go in after 6 days of progesterone instead of 5. So there are differences here that they didn't even acknowledge in the analysis, okay? That's huge because you're ignoring valuable data and it undermines the results. It undermines what you're seeing in the report. Okay, so where's the nitty gritty? It is right here for you all to see. So if you're watching on the YouTube, Facebook, and Twitter feeds, you're gonna see it. For those of you who are watching on Instagram, you're gonna have to take my word for it, okay? So did they see a difference in the protocol analysis? So they analyzed it by intention to treat, which is the right way to do it statistically. So to the group you were assigned to, not what you actually ended up doing, but what happened to you based on the group you were assigned to. Well, based on the group you were actually assigned to, you had no difference in pregnancy rate, no difference in implantation rate, and no difference in live birth rate on your first transfer. So on transfer number 1, it's totally useless to you. And that was the same between all the groups, whether they compared the personalized to the frozen or the personalized to the fresh, okay? There is no difference in those groups. What they did see, however, was a huge increase in the number of miscarriages in the patients that had done the personalized embryo transfer versus the ones that had not. So it was a 3.5-fold increase in your risk of miscarriage compared to the patients that were just going for a fresh embryo transfer. So in other words, if you do your ERA test and you go through the whole process and you follow their instructions, your miscarriage rate was 3.5-fold higher, 350% higher rate of miscarriage than not doing the ERA test. So then they said, well, what if we look at it by doing more cycles? What happens when we look at all of the cycles that were done over the course of a year? So now they saw a difference in the cumulative, they called it the cumulative pregnancy rate. So yes, there was an increase, 17% and 16% for versus frozen and versus fresh. So a slight increase. And then they analyzed the live birth rate and there's no difference. So when you analyze this as a per protocol assessment, there is absolutely no difference between the two groups, between the personalized embryo transfer and the frozen embryo transfer or the fresh. They all had the same live birth rate. Didn't matter if you did a personalized, didn't matter if you just skipped it and did it the normal way. Whatever way ended up, you got the same outcome at the end of it all, and the results ended up being the same. So, important thing here is when you statistically look at this using the correct statistical technique, there is no value to doing the ERA test, and this is from the people that did the ERA test, okay? They own this test. What did they show? Again, in the cumulative one, a higher risk of miscarriages. How high? 4.26. That's a 426% risk of, or increased risk of miscarriage compared to the baseline. So a huge jump forward in your miscarriage risk if you did the personalized embryo transfer versus the fresh. Now, both of those miscarriage risks were for the frozen with the personalized versus the fresh embryo transfer. But they didn't see it with the frozen embryo transfer. So not useful. So then these guys decided, well, we're not seeing the results that we want. Let's look at it for the groups that actually did what they were supposed to do. So this is instead of intention to treat, this is the actual protocol that they followed, okay? So when they looked at the protocol that they were supposed to follow, again, there is no difference on the first embryo transfer for live birth rate. They did see a borderline increase, and it was borderline, it's not statistically significant in pregnancy. They did see a significant increase in implantation, but there is no difference in live birth. The only time they see a difference in live birth is if you go down to the cumulative pregnancy rate and you're looking at the live birth rate and you're comparing personalized for the ones that actually followed through on their protocol versus the frozen or versus the fresh. Now, versus frozen, it is statistically significant, but the p-value is 0.04. It has to be less than 0.05. So again, it's kind of questionable. When they compared it to the fresh, it was highly significant, 0.003. But you're cheating because you're looking at it as a per protocol analysis, and that is not statistically valid. The statistical analysis says you must do it as an intention to treat analysis, and based on the intention to treat, because so many people fall out of the model, you don't have the data to analyze it any other way than saying, if we started with this plan, where are we going to end up? Not, hey, we started with this plan, but then it totally went screwy, half the patients fell off, and so we're just going to cherry pick the good ones and then decide what to do with that data. That data does show a difference, but that data is not valid. So basically, the bottom line is this does not demonstrate a statistically significant difference when you're analyzing the data appropriately. Okay, so one other part to this that's really important. Oh, we lost our YouTube and Instagram, our YouTube and our Facebook folks. So the computer's gone. So the one other part of this that's important is that they showed when they analyzed this that there were differences in the cost and that there was a huge difference in the number of people that needed to go through the process in order to actually have one difference in live birth. So when they analyzed this based on that nonsensical per protocol analysis, they showed that even then, in order to achieve one higher live birth, you need to put 7.2 people through the ERA test. Remember, there's $1,250 a piece in order to get one additional live birth. Is it worth it to put 7.2 people through an ERA test to get that result? Well, sure, for the one person that gets the live birth, of course it is. But for the other 6, they're out $1,250 a piece. And when they looked at it from a cost perspective, it does increase the costs without any significant benefit. So, is it a factor of fiction that the endometrial receptivity array works? It is a fiction. The endometrial receptivity array, by their own data from their own randomized controlled trial, it does not work. There is no benefit to doing the endometrial receptivity array because the per protocol analysis may show that there is a benefit, and only in cumulative, not in the first try. But when you looked at the intention to treat, it didn't help at all. Sorry, guys, I just got a Feltard. We did lose it. It died on us, so I'm not sure whether we'll have to restart it up again or not. So anyways, bottom line, guys, the ERA test is useless. Do not bother with the ERA test because it's expensive and it does not benefit patients. And I know there are people out there that are absolutely committed to the idea that this test works. And you know what? I'm not going to lie. For some people that we did it for, it made a difference. But is there data that demonstrates that it's actually beneficial? Not one study yet has proven that the ERA test actually increases your chances of ending up with a live birth. So where does this leave us? Well, do we still do it? Rarely I'll do it. Only in the patients who have a very, very thin endometrium, and that endometrium is so thin that we're worried that it's not going to implant. And because we're worried that it's not going to implant, we want to make sure that we can use them, or do we need to take them and use a different patient, in other words, a surrogate or a gestational carrier. Why is this important? Well, this is important because we want to make sure that in those patients, we don't need to take them to put them into a different person, which is super, super expensive, very costly. Sorry, guys, on Facebook and YouTube, we did have a computer battery problem there, so we're back. And you should be able to see us there again. So bottom line, for those of you, if you missed us, the endometrial receptivity array, by their own study, is proven not to work. And I actually had this from someone that very closely works in a managerial role for the entire company that sort of spawned iGenomics. And that individual told me a year ago in April that it doesn't work. So we only use it in patients who have thin endometrium, not for timing, but in order to determine, if we can make sure that that lining is at all receptive. Not for a timing reason, it has nothing to do with the timing. It's purely to make sure that that lining can actually receive an embryo at all. So fiction, do not spend the money on the ERA test. Please don't follow the ERA test. We had a surrogate here that we were monitoring for another fertility center who went through the whole thing. They were poking her every single day for blood. Ultrasounds, blood work. She wasn't an easy poke. We poked the poor woman to death on their behalf, and it didn't work. It's a total waste. Do not put your money into that test. Please, I beg you. It's a waste of money. Don't do it. Okay, so on to questions.